look at the disease model, then there is a tendency for all of us as professionals, but also for lay people out in the community, the public, to attribute the risk factors predominantly to the patient because it's a disease. If we then flip it and say, what if we look at it as a complication? Let's look at the complication model. Now, the minute you look at and frame something as a complication, the risk factors then have to be attributed much more broadly, which includes the patient, of course, but it includes the device, if it's an orthopedic device, the technique, and the clinician. So this is the natural way we would frame something if we regard it as a complication. So peri-implantitis is a disease. What has happened over the last 30 years is because we've regarded it as a disease, the majority of the research and the focus has been on host or patient-related risk factors. And this has been a good thing. It's been a good thing because we now have incredible levels of evidence to look at the risk factors for peri-implantitis as it relates to the host. But we haven't been so good at looking at the risk factors as it relates to other aspects and other potential risks. If we then consider peri-implantitis as a complication, how do we do this? And how do we change this in our mindset? Well, the first thing is, if firm opinion that most cases of peri-implantitis have an iatrogenic etiology, and that was established around the time of the treatment, whether it was the surgery, whether it was the prosthodontics, or whether it was the analysis of the patients and their systemic factors and so on and so forth. So what we need is to change the paradigm. And so I started out with dental implants being a man-made complication. We have to stop thinking of... We now universally need to start a movement where we begin to point the fingers at all those who perpetuate the myth that implantology is easy to do, that anybody can do this. And when a complication arises, we need to point the fingers back at where the complication started, because it almost always will have occurred in and around the time that the implant was placed or restored. Thank you very much for that.